Who knows? Where?
Can you record it for me?
This one? What is this? Is a urinary bladder, and this will be the what? Anteflexion, antevertex. This is the cervix of the, what is this here? The female internal organs, yes? So the first one, urinary bladder. What do we have for the urinary bladder? Apex, okay, so apex. So apex we may mark like this. And the apex is like, yeah, I think this it will be okay, yes? So here we have like the pubis symphysis, and here is the urinary bladder, this is the rectum and internal organs of the female internal organs, and the apex, which is a part where originate which ligament, who remember? This is the medial umbilical ligaments, exactly, yes? So here is this part, and the next one we have a fundus of the urinary bladder. So the fundus of the urinary bladder you have exactly here, yes, the fundus, and you must be careful because where we goes downwards here you find the trigonum of the urinary bladder. So here you see the smooth part of our mucus is visible. So smooth part of our mucus is like the triangular shaped. So this must be the trigon, yes, or the trigona of bladder. So exactly here is visible the trigona of bladder, or we may look for this specimen, or here we have a bladder. Here probably we check. Yes, okay. So this is the same urinary bladder, but this is a full during the death. Yes, here is empty during the death. So here you see we have the fundus of urinary bladder. No is visible apex of urinary bladder, and here we have a trigon of urinary bladder. Which structures limitate the trigon of urinary bladder? Here you see we have like a two internal orifice of urethra. Yes, so probably you have where or urethral orifice. So where is a visible urethral orifice? Here is a visible. This one and here. So when I mark like this, to answer it will be correct. Yes, you may write the trigon of urinary bladder, but the most correct answer was the urethral orifice. The median umbilical ligament I show you, cervix of the bladder is visible exactly here. Yes, so the cervix of the bladder and internal urethral orifice, which show you like the apex of our trigon of the bladder. So exactly now I marked you the internal urethral orifice. Okay, so number 41. Male urethra, female urethra. So the male urethra, we have like the parts, but here is visible, yes. So, oh, it's not visible completely, it's not visible here, but maybe for this specimen, I check. Yes, this is a good view. So, which part of we have? Intermular part, yes. So here where we marked, always you must write the intermular, like this, intermular part of the male urethra. The next part here must be the which glands? Prostatic glands. So this must be the part of the prostatic part of the male urethra. And here look, we have a muscles, which forms the urogenital diaphragm. So which part now I marked for this line? This is the what? No, this is the which part? The third part of the male urethra. So the first intermular, this is the prostatic part, and here we have membranous part. Yes. So the membranous part, and after this, the urethra look here passes cross the line, which is a pubis symphysis line, and here the puncture of the which part of the spongious part of the penis. So here we have a spongious part of the male urethra. Yes? So here we have 4 parts, like the intermular, prostatic, membranous part, which is surrounded by the external sphincter of urethra, and here is a sponge as this part of the male urethra. The female urethra, we have the females, yes, here, so visible, so I show you. Use this specimen. Probably this is the female urethra, yes, but this is like only the topographic region which I may show you. So here we have a intermular part of the female urethra. So here is, yes, when I pierces this part of the urinary bladder, so the intermular part, membranous part. Where is the membranous part? The membranous part is exactly here, for the level of the urogenital diaphragm. Supradiaphragmatic and infradiaphragmatic or subdiaphragmatic part. So the supradiaphragmatic part, this is the part between the intermular part and membranous part, because this is like our diaphragm, so exactly here. And all what we marked here, which open to the vestibule of the vaginal vestibule, must be the subdiaphragmatic part. So the intermular, supradiaphragmatic, membranous part, and subdiaphragmatic part of the female urethra. And we back now to the testes, so to the gonads of the male gonads. What we have for the main gonads in your list? Please give me the structures. Tunica albuginea is visible here. Look, you see this specimen or no? It's first time where you see this specimen. So tunica albuginea is visible. So I made mark like this. Yes? Tunica albuginea of testis, lobes of testis. The lobes of testis here is visible, but this is passes between the vessels. So here is like the, oh, here is a septum. So all what I marked like this. You may write the lobes of testis, or this is convoluted seminiferous, like the ducts. You see, the convoluted is visible, like a spiral shaped. Now it's visible. So if I mark like this, only one, this is of course the convoluted semiferous ducts, okay? And after this, we have a rete, but the rete of the testis is visible exactly for these places here. So this is the position where you have a rete of the testis, testicular artery, testicular vein. Here, what is this visible? This is a spermatic cord, yes? So in a spermatic cord, this what I keep now must be the artery. So this is the testicular artery, which is may marked for the spermatic cord. I pierced this artery, or artery which passes in a, of course, here, but where we use the whole cadavers, whole human bodies, okay? Where start from the aorta, so we may mark. The testicular vein, from these isolated structures, it's not possible to mark, because like you remember, for the first part of our spermatic cord, we do not have the testicular vein. Only this is the pampiniform plexuses. Yes, so this is the pampiniform plexuses. You have for the pampiniform plexuses? No?
No.
You, and here we have
Epidermis.
epididymis. Okay, so what's for the epididymis? These are structures like the head of epididymis. We mark like this. This is the body of epididymis. And finally, for the inferior pole of our testis, you find it the tail of epididymis. Yes? And the sinus. What is a sinus? Who knows?
Gono.
Here.
Between the epididymis and the testis, between the head and the body.
Exactly. So now you say like the definitions, yes, and we marked for these places. So between head, body, and the testes, here you see the sinus of epididymis. We like marked with the Monica this structure, so you may, of course, receive the spins during the practical test. And the ductus deferens or a vas deferens. Ductus deferens here is visible. So this is the ductus deferens. This is not artery. Artery is visible here, okay? So this is the testicular artery, and this is the ductus deferens with spermatic cord. So all of this, what you see here, where I pierce it like this, you name the structure spermatic cord. Because the spermatic cord is a fascia, it's a muscles, all arteries, pampiniform plexuses, the ductus deferences. So all the structures which is surrounded by the external and the internal fascia must be the name like a spermatic cord. Which part of spermatic cord is visible here? Here we have a testicular part, and here is visible like the spermatic cord, part of the ductus deferences, which of course has like the 4 parts. So the inguinal part and the pelvis part, cremasteric muscle. I show you. Here is visible all of these fibers, muscle. So this one. This is the cremasteric muscle, okay? So you do not have for the list pampiniform plexuses or what?
No.
So this is no problem for the recognizes, okay? Here we have pampiniform plexuses. This is this one, but here is most outer layer of the spermatic cord must be the muscles, which is the muscles which elevate and the depressed the testes, seminal glands, and the prostate. Here is not visible, or maybe we find it here. We try to check. Here we have, yes, it's visible. Look, where is the seminal glands? The seminal glands, like you remember, is a position front or posteriorly to the bladder, urinary bladder. Posteriorly, yes. So in between the pouches, between the vesico-rectal pouches, and all of this, what now I show you here, this must be the seminal vesical glands. Yes, all of this here is visible, like the ampulla of seminal vesical glands. So here is, what is this visible? This must be the ductus deferens, which is a continuate position here, receive the ducts for the seminal glands and forms ejaculatory ducts. And prostate, for this specimen, which we have an isolated specimen, where is a prostate? The prostate glands is inferiorly than the position of your the urinary bladder. Urinary bladder sits for the prostate gland. So all of this, which is a mass, hard mass here, yes, where you palpate this, this is the prostate. So I mark like this. Prostate glands, prostate. And here is a visible some part of what is this? Who knows? This is the urethra. Look. Yes? So the intermular part of urethra, prostatic part of urethra, and this must be the membranous part of the urethra. Here is visible. So all of this must be surrounded by the muscles. The penis. So what do we have here? The glands of penis. The glands. Here is with the penis? No. But here is visible. So the glands of the penis. So we may pierce it like this. Yes, glands of the penis. The external orifice of male urethra. Here is visible external orifice. And the external orifice forms like the dilatations, which is a name, navicular fossa. You do not have a navicular fossa for the list, but this is a part one. Corona of glands, penis. Where is the corona? Corona usually is like the top of the head, but here the corona forms this fold. Yes, so here is the corona of the glands of penis. So like like this is possible to mark. Okay, so now is a corona of glands of penis, prepuce of penis or fascicle. Okay, frenulum of pelvis. So the prepuce, this is like this part. Here is, yes, visible. So this one, number, what is this? The 68, yes. And the frenulum of penis. Here is not visible. The frenulum is exactly for this position, yes? Like this. Here is the frenulum of the penis. Why are you laughing? Okay, corpus cavernosus and corpus spongiosus. So I show you. Here we have the part of the corpus cavernosus. Here is visible. Corpus spongiosus is a position here. So corpus cavernosus and spongiosus. We have a more specific. Oh yes. So here is this is really good view. So look here. I think this is the best to mark the two corpori mass. So the corpus, what is this? Cavernosus, and here corpus spongiosus with the bulb of the corpus spongiosus, which is the end and forms the glands of the penis. And scrotum, here we have a scrotum, so we may mark like this, yes? So the scrotum, external genitalial system of the male. And the female, over an artery and vein, we may mark for the whole bodies, but ovary. I try to show you ovary. You find it, the ovary? I know we have one specimen, which is a specimen of the specimen for the whole human bodies, where we have ovaries. Here is not visible, maybe. I try to show you. This is a part of, no. Oh, here is, look, this one is visible. You see? This is the ovary. So when I use this specimen, why not mark? Ovary, yes, here. Ovarian artery and veins. This is not visible, but passes here for the suspensoris ligament of ovary. And what more? Uterine tube. Oh, fallopian tube. So where is it? Exactly here, look. All of this is visible. The fallopian tube with infundibulum. So this is this one. Infundibulum of the fallopian tube. I may pierce it for these structures, but of course the smallest pins when I use. Ampulla. Where is the ampulla? Ampulla, this is this part. From infundibulum to isthmus. So all of this must be the ampulla of fallopian tube. The next one, isthmus of fallopian tube. And after this, look for the ischium. Here we have which part? The uterine part, but it's not visible for your list. And the last one, fimbrias, which is a fimbrias visible here, like the small digits, you see? So all of this is a fimbria of the fallopian tube and the uterus, body of uterus. Here is visible, but I have a really good specimen which I like when I show you. No, this one. Oh, here is. So this is a really good view. So here, body of the uterus, yes, visible like this one, which is covered by the, what is this? Who knows? You do not have for the list probably. But what is this? Yes, and the perimetrium. Peritoneum, perimetrium. Co tam, Jacku? Dobrze. Dziękuję. A gdzie był? U Mariusza czy gdzie? Stary już jest, ale to dziękuję bardzo. So perimetrium, this is a part of the, peritoneum layers which covered the body of the uterus. Fundus of uterus, this is like our apical part of uterus. So here is a fundus, body. The next one, isthmus of uterus. So when we open this uterus, the isthmus, we may mark you here, exactly for this position. Yes, isthmus of uterus, cervix of uterus. What is the cervix? Cervix is visible here, where we cross this ligament. And this ligament, this is the recto-uterine ligament. So here is the cervix of uterus. And when we open the vagina, you may find it two lips. Now it's visible, you see? So when we put this specimen front to you, here you find it, the anterior and posterior lip of the cervix of uterus cervix. So anterior, posterior, no superior, inferior, please remember, okay? And here we have a fornix, so like the anterior, superior, and the inferior fornix of vagina, which is not for the list. And the vagina, here is visible, mons pubis labia, okay, so this is a vagina, this is the anterior wall, posterior wall with the rouge, yes, so here is a rugal vaginal folds, and here is visible root. Look, what is this? What do you think? This is a muscle where you have like the membraneous part of female urethra. Yes, so which muscle? External sphincter muscles of the female urethra. And now inside of the female urethra is a pins. Yes, because the urethra passes corresponding with the anterior wall of the vagina. And the next one, mons pubis, the mons pubis. So here is visible mons pubis, all of this one. So here, mons pubis, yes, with the fat tissue, the labia majora and minora. So labia majora, we may mark like this, labia minora, which is visible here, clitoris and vestibule. Okay, so I show you for this section here, we have like the vestibule, so majora, labia majora, labia minora, and here is the vestibular, like a vaginal vestibule. So exactly here, we're open, like you know, the greater vestibular, like the ducts, which is a ducts for the vestibular part of the, this is the Bartholin ducts or Bartholin glands. And one more, clitoris. Here is a visible, this one, this part, chest. So here is the clitoris part and a rectum, internal iliac artery, internal iliac uterine artery. The rectum, where is the rectum here? This is visible, this one, rectum, or here, yes, these two, rectum and rectum, internal iliac artery, internal iliac vein. So this both internal is visible here. This is the external, please remember, internal iliac artery with two branches, so anterior part and posterior part, or anterior and posterior branch, and here is the internal iliac veins. Uterine artery, of course, why not mark? This is very important arteries, and I show you this artery is here is visible. Look, like a spiral arteries. You see? So this must be the uterine artery, and this is the last one.
Yep.
Okay. So please now continue it once.